What happened on my LinkedIn account was he kept flashing up, going, we need somebody from the clinical laboratory to talk. We need somebody from the clinical laboratory to talk about courier service. And I'm going, well, I don't know anything about courier service. They come, they pick up our stuff, they leave. So I'm just going to take it from my point of view. When I put this PowerPoint together, here's the ideas that I came up with. I wanted to talk about the employees, the cost, the training associated with it, transportation, dispatch systems, specimen handling, Obamacare, and partnerships. Those are like my big topics. Each one of these to me could be like a whole entire presentation on itself. So if I'm just going to kind of skim through things you already know, too bad. If I'm going to tell you stuff that you don't know, good. We see couriers in 3 separate categories in the laboratory. We only see them as being internal, external, or a mixture of the two. When we talk about internal couriers, that's where we actually train the employees. We have all the costs associated with them. So we're going to buy the company cars, we're going to pay the salaries, we're going to do all the benefits, we're going to do all the training. They are considered part of our healthcare team. And the reason that laboratories love those internal couriers is this one right here. Whatever we want you to pick up and whatever we want you to take, that's what we're going to give you. And unfortunately, or fortunately, I don't know, the expectation is that the external couriers are going to do the same thing. I know that we like to talk about the external couriers are actually contracted with outside sources, and the logistics is then managed by you guys. And these employees are hired and trained by the vendor, and the performance, which we hate, is outside of our jurisdiction. So that, what I'm trying to get at for this point is, I think that the lab we're control freaks if you didn't really understand that about us. And we really like to know where everything is all the time. And I think it's because we're so regulation driven that that's just a part of our background that we have to have that with us. So one of the falters with the external couriers is for us that they kind of aren't used to just taking and going with whatever we're giving them. This is the most common that I've seen of the systems, having internal courier services and external couriers. And how we actually used it was our internal courier service, we actually had them go to our outreach. They would go to our physician offices. We called it our doctor's office services. They'd go around the town, pick up from those lock boxes. And the reason that we actually put the internal courier services on our physician routes is because the doctors like to do what they want to do too. So their lock boxes could be anywhere. And they just expect you to know it's hanging on the gate outside, what's wrong with you? Or it's actually behind my door. Or it's hanging next to my door along with the other 5 couriers that I may use. On our external couriers, we use them to go between hospital sites. They just did round and round between our outpatient imaging center, our cancer treatment center, the 2 rapid response hospitals, and down to the core lab. So we had them going around every 2 hours, every 2 hours, every 2 hours. But that was part of the thing of, I guess when we first signed the contract, because I'm not part of that. Purchasing for the hospitals is usually the ones going, we really aren't involved in the clinical lab, but you're going to sign the contract with our purchasing department. We really don't know what the lab's doing. We just know they test stuff, but you're going to sign the contract here saying that we know what's going on. Well, we're going to do the expectations since you're running around between those hospital sites. If we have our 5-gallon cubes of isoton that we need to get to another facility, we want you to take that with you. So hopefully, I mean, I've seen it where they come in with dollies and we just keep stacking stuff on top of your stuff. We have like bins inside our laboratory for all our different sites. All the areas in the hospital can come down and throw bins into our laboratory to take to the different areas. I'm just kind of giving you a little scene of how chaotic it is for us too. We don't know how we got into the courier system. We didn't really want that to be our bailiwick. When I get to tell you what else we actually do in the laboratory, you'll see what we think about the courier service. No, we don't like you. It's just a small part of what we do. And then a lot of times we use the external courier service to supplement what we're doing, because what we are in is a state of flux. So right now, because of when I go into the Obamacare, everybody's freaking out about what's going on, one more change again. I've been in healthcare long enough, since I was 2, that I've seen it called all sorts of stuff. It's the blueprint for change, it's variable staffing, it's whatever, because we have had so many regulations come down. Every time they go to change something, you're right in that flux where everybody's freaking out right now in healthcare. I swear we'll be okay. So anyway, back to the mixture systems. Since we are changing, we have a lot of routes that go on. And so a lot of new doctor's offices are being added. We may have a lot of stats. So we're calling our external courier because we think you can actually respond better than we can doing that. Well, we just don't. No, I could go into the lab. That's a whole nother conversation. So I actually went out there, since courier system, I'm lab manager. That's what I did. So really, in a way, I was responsible for couriers, but not all the way. I went and asked the person that runs the outreach and said, tell me what you think employee positives are for your couriers. For internal and external, you do way better with standard route pickups. I see a problem with that. We got to get way better at all the unusual stuff that's going to go on, because it's never going to go away. They're willing to work long hours. I loved your conversation yesterday between ICs and whatever you were talking about. We don't care. Yeah. We see you as you. Yeah. Just go take our stuff.
I got a quick question.
Come on, man. Tell us the way you really feel.
I have a quick question. I'm sorry to interrupt
Sure,
you.
you're fine.
Now you say, that's my take the whole time. We just want our stuff delivered. Now you say the wheel carrier. Is that your perception, or is that when you go to conferences, that's kind of everybody that you deal with in labs across the country? I think they just want their stuff done.
We want it done. We want it done right.
Yeah.
I mean, I'm going to go right into that. I'm telling you, I saw the dispatch, this communication stuff. Honestly, you need to sell yourself. Mm-hmm. Anyway, they said that the employees, really, they work hard. They're very courteous. For us, our good employees have been semi-retired. They have, of course, a good driving record. We really need this. A good work ethic, and they're required to transport heavy packages. That's what I said. We have no qualms about, we have to get our patient testing done. If we've got that 5-gallon isoton cube to go, we're going to stack it right on top of our cooler specimen and say, have a great day. See you in 2 hours. And then, of course, it always helps to be able to know where you're going and read maps and GPS systems. She told me about her external courier negatives, and this is what has happened to us. And there's more. But we've actually used people to cover vacation time, sick time, and they don't show up. Well, our doctor's offices, our hospitals, we never close. Somebody was saying something yesterday too about, I want to work Monday through Friday, no weekends, no holidays, first shift only. Our patients are not listening to that, just so you know. So we can't have this happen, and we have to be notified when they're calling off. Because you know what I've done? When I was thinking about putting this speech together, it's like, I've been that courier. I've delivered the reagents to the other sites. I've taken those stat specimens where they need to belong.
Mm-hmm. As a lab manager.
As a lab manager, that's correct.
Yeah.
That's when I said, when I first said, what do I know about courier? Oh, I've been one, that's it. So then I just wanted to talk a little bit about cost, because I'm sure you're all familiar with that. I was told that some of you people, some of you guys out here, aren't really in medical courier yet, but want to get into medical courier. Well, it doesn't matter if it's internal or external. We have all these costs associated with what's happening, and probably more that I couldn't think of, because like I said, that's not really what I'm doing. We've got the car maintenance, so that's your oil changes and brakes and tire rotations, etc. When we finally stop maintaining our cars, usually when the engines blow up and the transmission goes. And then we say, oh, we really need to get a new car. Don't ask me, they picked Toyota Camrys here. Average price I took is about $20,000 for those cars. They've lasted over 200,000 miles. The training associated with it is all the other stuff that when I get to the regulations, the bloodborne pathogens, how to actually ship and package and pick up and And then we give them gas credit cards. I love that. I just took averages. I just love to Google this stuff because it was so interesting to go, here's, depending on states, they said, that's just depending on the city to me. For the gas prices, it can be over on this street, 333, and down the street, 385.
And it could be a pickup or a van versus that, and it'd double that quick.
Right. Well, and the car insurance was about 150, they said, the national average. We have something in Ohio, I don't know if it's comparable in every other state, but if you get so many tickets, we have to send you back through driver's ed, or our insurance rates get really jacked up. And I love that one. Body work fender benders. They never saw my son. He laid 2 deers up on my car. $2,200 for that fender bender and totaled the other car. But I just went with what they said. And then, of course, the salaries they said for a courier was about $28,000. And then for the hospital, we also take in that they are our employees, they're our healthcare team. They're part of our 401k. They get health insurance from us even if they work part-time. So that might be some of the competition that you're going with healthcare. They do offer that. Now, my favorite people. Yeah. Here's slide number 1 of who's regulating lab as we know it. OSHA. We love that. That's all about how to keep your employees safe. Somebody asked what fines were. I can tell you usually when they walk in the hospital for us, $10,000 every time they find something. That's what they normally find us. You can actually have OSHA come in for one reason into the hospital. Once they're in there, they can go anywhere they want.
Sounds like the DOL.
Yeah.
I'm telling you. So it's kind of like you're going, oh, great. So somebody said something about carrying the specimens the wrong way with OSHA. Oh, they would have been all over our hospital.
Yeah.
Then you got the CDC. They are going to dictate what bloodborne pathogens are. The Department of Transportation, because we actually do transport stuff by ground, they come and visit the people in the lab. Had his little book and he said, let's talk about page 35. And I'm like, I don't know page 35. Then we have IATA. Of course, that's if you're going to transport stuff through planes, you have to know about that. If you're going to transport stuff across the seas, you've got the International Aviation Organization. You got WHO that's sitting back saying this is what is pathogenic and this is what's not pathogenic. And then you have CLIA for us, the Clinical Laboratory Improvement Amendments, something the government came up with, just so you know, as well, actually dictates who's allowed to do what in the laboratory. I said that could be a whole conference on itself. And then there's more. We have more people we get to talk to. The College of American Pathologists, most of the laboratories in the United States are actually regulated and certified by that. They come in every 2 years to make sure that we're following policies and procedures. Each part of the laboratory is divided into separate areas. So when you hear us talking Greek, hematology, coagulation, transfusion medicine, urinalysis, body fluids, anatomy and physiology, anatomical path, there are checklists, which are not just a page long. They're usually 40 up to like maybe 100 on back and side of all these questions of are you doing this? Are you doing this? Are you doing this? And then they set out a whole team of inspectors to make sure once you said you're doing this, show us that you're doing all that. The Joint Commission, I'm sure you all know, they come in and they regulate the hospital. We like to see them. They usually come every 3 years. And then they go all over to make sure, for us, they will come in, they will follow a phlebotomist that draws a blood bank specimen. They'll follow that specimen all the way down into the laboratory. They'll come down and follow a unit of blood all the way up to see that we're hanging it correctly. And the reason I brought up the FDA is the FDA looks at that blood product as a type of medication, for lack of a better word, so that if we would actually hang the wrong unit on you, which has been done before in the hospitals, the FDA is in there the next day wanting to know what went wrong, because if you give the person the wrong unit of blood, you can kill them. We have another fun thing in our state and maybe other states. It's called the Ohio Department of Health. They like to come in and visit too. Why they come in and visit the lab, we're not too sure. But once they're in, I guess they just want to come and talk to us as well. And then you're going to get a whole bunch of HIPAA this afternoon. I said it could be a whole speech. And the reason I'm bringing this up, our hospital has something called BAAs. Every vendor that we work with has to sign a BAA that you're going to protect our patient information. And you know what, if you don't, you're liable with us. So that'll be very important when you get to that piece of why we're doing that. We like to share the wealth.
Pam, can I ask you a question?
Sure.
That would be share the liability. That's
Can you touch on JACO, hospitals that are trying to get accredited by JACO and how that affects outsourced people that you do business with?
Okay, JACO is TJC. They
Okay.
just changed their name.
Oh, okay,
Joint
okay.
Commission Accreditation Hospitals or whatever it was is now the Joint Commission.
Okay.
Don't ask me. They just want to keep you on your toes.
Exactly.
They really, when they come in, they're going to look at what your practices are. I mean, we're kind of protected because we whip out our BAAs of everything that you agree that you're going to do with us.
Yep.
And we're afraid to ask. So the Joint Commission is going to go based on what your facility is doing. So we're already making sure that you're complying as we bring you in to how we have to abide by those regulations for our accreditation.
Okay.
And if we don't, I mean, they can come in and they can cite you on certain things, and there's like different phases, if you want to say, of deficiencies that you can get. You have some of them you can actually fix on site. Some of them they're not that like bad that put you on remediation, and some are actually remedial stuff that they'll come back in after you say you fixed it and they'll check. Normally, Couriers is not what gets us in,
Okay.
Well, then I was asked too, this was interesting because they said, okay, so does the hospital send out staff need training if there's a courier packing the box? I don't know, some small hospitals think that if you're packing it for us that we don't have to be trained. That's absolutely incorrect. If we're going to classify the specimens, which we are every time we're getting out that sheet and telling you what tests we want, we've classified that specimen in a way. So we actually have to train them, whether it be the hospital packing it, putting it in a little baggie for you, the clinic, or the doctor's. It's all considered. You're shipping that package for transport or getting it ready, you're liable. So does the person placing the specimens in the box for shipment need to be certified? Any person that handles a specimen for transport has to be trained and certified to handle those medical specimens. And then what categories of specimens require dangerous good training?
Category
Yep. And staff has to be trained to actually handle that. So, and a lot of our plates are considered category A for micro. So, and where can staff learn this? Every employer has to provide training. So we actually have to do the same thing that you're doing for your employer. Is every 2 years, IATA says you have to train your people. Even if nothing's changed, you got to train them unless the regulations change. And so far, they haven't changed that I've seen. We've done it every 2 years.
Can I interrupt? There's some ICs for training responsibility. Isn't there some issues with that for us? Where the IC is responsible for his own training, where we train him in our office, there's that. We're the provider of that.
Dominic, you're up there. It's a
Dominic?
customer requirement.
It's a customer.
Oh, you have to have it.
You don't escape any training, just as bad.
No, not escaping, I'm talking about the responsibility of it. I see nobody
The
answers that.
spin is it's customer required training. Not
It's
your-
great.
Not your business.
Yeah.
Career Express is not training the IC. I'm providing them training required by my customer.
And I'm going to say our BAA agreement is going to say you're doing that somehow, some way.
Right.
I'll tell you that.
So you're gonna tap dance around it with
Mhm.
the Department of Labor.
Okay, now, when you do tap dance, what do you use as your legitimate training stuff? What you create, or is there a standard? See, that's where it's really gray. I personally have been lucky because I'm using the companies provide those modules for us to use. But if the company requires it but does not provide it, where does the IC fall?
Well,
It's always
see-
been gray.
See, I've got 5 different customer-provided training programs. I have a Kangaroo training program. I can go out to DOT and download the publicly provided hazardous material training.
I got that.
You know, so you can make them take that. If you send them an ARUP or a Mayo Lab training program, tell them take it, sign, acknowledge that they've done it through the online test, you've pushed it off to ARUP.
Got
You
it.
know, but if you send them Kangaroo Express and you do that, you're going to expose yourself. But I require them to do that under the terms of their contract. Take mine as well.
We have a client that's utilizing the ARUP, providing service to ARUP,
Right.
and they have satisfied all the training requirements, they passed all the tests and all that. But I'm gonna get a copy of the BAA.
Your BAA is made
and
up of
take a
your
look at
lawyer.
that Also,
I mean, our lawyers make up our BAA. It's personal to our
Must be good
system.
reading it.
Right.
Just so you know, it's not
Yeah.
like
Yeah,
this
right.
BAA would look like.
This BA.
No,
Right.
no,
The hospital, right.
Well, that's what I'm asking. I'd like to see a copy of it. I'm sure all you folks have seen it. I don't know if we have, so we need to take a look at it also.
You got to look at your own state. Colorado has court law on ICs in the courier industry. So we have precedent that we can turn to in Colorado. Some states have no precedent right now, and you might be setting it. And our IC contract stipulates their compliance with some issues like this, as doing business with me.
Right. And that's why I said that's all behind the scenes stuff, because we're gonna come at you saying that IC person represents you. And when something happens, we're coming back to you.
Yeah.
I'm just, that's the way it is for us. But we've got enough to keep up with our doctors, okay?
Go get them, Pam.
And the DOT regulations, they have to be held as long as the employee is retained at the company and 90 days thereafter. All right, so I'm gonna classify the specimens in for you. You got exempt human specimens. This is where, if there's a possible leakage that might happen, they believe there's no pathogens present that are going to harm you. And as long as you label it saying exempt human, you're okay. Category B is biological substances which are infectious that don't fit into category A. And category A is an infectious substance. When it's transported, if you got exposed to it, you could have some kind of debilitating disability, some life-threatening thing happen in a normal, healthy human being. So, I just love this. Shipping. We have to do all this too. So, the reason that I actually put it up here is because when we actually do the shipping and transportation of packages, it's normally an entry-level position in the laboratory that's doing this. So that creates some issues for us as well. We're in a constant state of training people at times because our phlebotomy staff or our processing group have a higher turnover rate than the techs do. We've tried to stem that away by actually doing some kind of career ladder that you're a phlebotomist and then a processor and then maybe work in point of care testing. But still, it's just the nature of healthcare that they're either going to school, it's an entry-level position that they're going to become a nurse or maybe a med tech or who knows what all, doing IT stuff, because a hospital is a little city. We need all sorts of stuff in that little city to make us work. Dietary, environmental, everything. So they have to be trained how to pack correctly. They have to know how to classify the specimens to be shipped in the right group. We try to standardize all the procedures for shipping that we have to write, because remember all those regulations? CAP says so. We have to be trained on everything we do before we even do it, or we're going to get dinged. It's a phase 2 deficiency for us. Well, I have probably 40 people that I have to keep up to snuff on this stuff just in my site, and we're not a huge hospital. There's only like 6 or 7 of the laboratories. I can't even imagine. I was talking to somebody yesterday, 37. I think HCA has 160 hospitals, so there's some pretty huge systems out there. Then you have to be very cognizant of what the temperatures are at. We're going to talk a little bit about the stability. Stuff that's frozen needs to stay frozen, not freeze and thaw and refreeze. We've already damaged the analytes. Do all the doctor's offices know that? Should you run the test?
Do you anyways?
If we know, the lab knows no. If you refreeze it and we don't know, probably. We're going to talk a little bit about where this recognition of what I should and shouldn't be doing in just a few slides.
Oh, it sounds like a lot of contribution negligence to me.
And then if they have to be refrigerated or kept at room temperature, they have to stay at that. If you actually put LDH isoenzymes, which LDH, I'll talk a little bit more about, is an energy producer enzyme in your body. It's found in almost everything. You're going to elevate that and make it look like people have muscle damage or something happened to them. When it didn't. The specimen just wasn't held right. And then, of course, the extreme heats, hot and cold. Blood does not like that. Blood just likes to be where it's supposed to be and stay that way. And then you have to follow basic infection control procedures using universal precautions. OSHA dictates that any kind of body fluid is potentially infectious, and so they want you to use all that PPE. We have to have gowns, goggles, gloves, the little, whatever the little thing was with the scraper and the broom. Yeah, spill kits. Here's your little labeling. We have these two. We all have to take responsibility of the shipper, where it's coming from, who's shipping it, the consignee, who we're going to send this specimen to. And then, of course, it has to even get more to the responsible party. We want your name and phone number on here so we can actually come back to you if something's happening. And then you have to do a class 6 infectious substance. You put your category A on there, and you put that UN 2814 label on there that says it's category A. And I love it. It gets even better because then, if you have to use dry ice because you need to keep it frozen all the time, we've got the class 9 miscellaneous label to go as well. And then, of course, you want to label this side up on the box. And those double arrows have to be on the opposite side of all the other labels that you've got sticking on your package to ship away. And make sure the tape only goes in one direction. And you have to leave enough headspace in that container as your dry ice actually evaporates or melts, as you want to say, that it can dissipate and go out into the atmosphere, or your package can go boom. We like dry ice in the laboratory. We put it in our sink and we just look like Halloween.
Like a magic trick.
It is. It's great.
Yeah.
So, ground transportation. Well, usually if you see it, the box is like this big. There's a little bit of dry ice on there. Oh, and you can't go over 2.2 kilograms of dry ice. But you have to have the exact weight of what you've stuck in there. We in the laboratory like to try and stay away from the dry ice and make you guys bring it. I just wanted to let you know. Thanks for bringing that up to me for that side note. Okay, ground transportation. Exempt human specimens aren't regulated by ground.
Exactly.
Category A and B are regulated by the DOT. And what the DOT says is anything a dedicated, private, or even if it's contracted carrier, if that motor vehicle is used exclusively to transport specimens, you are a courier there and going to be regulated by DOT based on those classifications. Even if you're transporting other stuff for us. So you can't get away going, I'm just bringing medical records. And that tube won't work. You bring a tube, you're a courier. Air transportation, anything that's chartered, commercial, or cargo aircraft, if it's used for the transportation of specimens, guess what? To reference lab, you're going to be regulated by IATA. And you have to follow all their guidelines that are listed in their air transport options. We, in the clinical lab, do not like to get into this piece. We like you to do this piece as well. And then, of course, all the regulations for dry ice, category A, B, the labeling, etc., all those guidelines have to be followed. So now we're going to get into factors which can damage a specimen during transportation. Here's how sophisticated our courier system is. In those little Toyotas, Camrys, we want to make sure that you put a seatbelt on that cooler, or you put it in the bottom of the floor so the specimens aren't jostled. We actually have coolers that the specimens are put in, and they're put in racks so that we keep them upright while we're transporting them, and the racks are actually placed in bags. And then we have a division in our coolers for ice and room temperature with, thermometers or whatever, taking around to make sure that they actually arrive at our facility at the temperature that they're supposed to be at. So the internal couriers, we pretty much know if it's coming in that it's been held right, that specimen. The reason that we've done this, it goes back to our physician offices. I'm just going to tell you, if they're handing you tubes that they just took out of my arm and said, go away with Pam's stuff, here's it is in a baggie. Every tube vendor that makes the Vacutainer tubes will tell you that if the blood is going to clot, it has to remain upright for 30 minutes. The lab, we have to follow that regulation, go back to CAP, and they will ding us as a phase 2 deficiency, because what we've done is if we're not following what the manufacturer says, we've just made our testing high complexity. Because if we're not following what the manufacturer says, we have to validate that. A validation for the FDA is usually about 1,000 specimens. Okay. All right, here's the number one thing that aggravates everybody. Lost or compromised specimens. That is a major physician and patient dissatisfaction. When you lose the specimens and we can't run the test, we get called. The doctor is irate. We either have to call the patient back to tell them, ew, it got lost. They don't care if you lost it, because the bottom line was it was our lab, so we lost it. It's all in that, what'd you say, that shared liability?
Contribution negligence.
There you go. And then we have to call the patient back in, and you can imagine how irate they are, because it goes back to the next thing is, if you're not picking their specimens up in a timely fashion, or you're forgetting the pickups, eventually, even if we do get the specimen, you've delayed that testing. There are physician offices that leave their patients sitting in there. One of the biggest tests they leave them sit there for is a PT, when a patient's on Coumadin, because they want to make sure that they're not going to bleed to death, and they want us to run that test while the patient's sitting in their office waiting. Well, you can imagine if we're not getting it in a timely fashion, which our couriers give us a 90-minute window to pick up a stack, the external ones. That's already 92 minutes too late for the doctor, just so you know. Not emptying the coolers is something else that's happened to us, that it doesn't do us any good if it remains in your trunk. Usually if it's not given to us in a certain time frame, some tests are good for 4 hours, some tests are good for 24 hours. When you get past 24 hours, if it hasn't been spun, it's a crapshoot. We're at a gambling casino of what tests we can and can't do. That goes right back to the physician aggravated, they call the laboratory, the patient's aggravated, we have to tell them, oh, I'm sorry, we can't give you that diagnosis yet because you don't have your specimen, we didn't run it. It got lost, it got forgotten, it was left in somebody's trunk. And then of course not maintaining the stability for that specimen integrity, same kind of stuff. It's either going to be recollect, physician's mad, patient's mad.
Seems like there's a lot of responsibility.
In medical
A lot of
current,
regulation, right?
yeah, for medical,
And I'm confused. You're gonna help me out here.
no.
No. Then they go bid for the work, and they give it to the cheapest bidder, and nobody gives a damn about the specimen because they went on price, because purchasing is not talking to somebody like you. There goes
Yes.
contribution negligence.
There goes integrity.
There you go.
But you're going to overcome that, right?
Not at the price point.
We'll talk a little bit about that.
All
We
right.
don't necessarily go on price where I'm at. So I think we've been in the business, like I said, 20 years, 22.
22.
So I think we've got a little bit more going. We kind of mandate our purchasing a little bit here.
Atta girl.
So let's talk about blood. So there's what a red cell looks like. Nice little red donut. That little red donut is really, really, really fragile. When you don't keep the temperature, it doesn't like to be frozen because it'll burst. Doesn't like to get too hot because it'll burst. When the red cell breaks apart, you have your hemoglobin and hematocrit released, and of course you don't have as many red cells anymore because they broke apart. When your hemoglobin and your hematocrit are released into your bloodstream, these analytes, I just named off some of them, actually increase in concentration. So my potassium goes up, phosphorus, LDH, your total protein, your AST, albumin, acid phos, magnesium, iron, calcium, and your ALT. What does that mean? That means that if we don't catch it, and a lot of times with the decreased red blood cells, we may not catch it, because we're actually, when you see the purple top tubes, those are the EDTA tubes. Those are the ones that are run for the CBCs. Those tubes stay the way that you see them. The blood is still mixable. If you've ever sat there and rotated them, that's the way we run them. We mix them up, shove that whole blood up on the analyzer, press go, and it's taking red cells, white cells, platelets, and it's making a count of how many's in your bloodstream. So we may not catch that it lysed, that you did this and shook it up when you mixed it. Nurses do that to us, just so you know. A lot of times we can catch it if we have chemistry tubes with it, and I'll show you in a minute why. But the red cells, their most important function is they carry the oxygen all throughout your body. And then they're going to take all the carbon dioxide back to the lungs and exhale it out. So, if your red cells look decreased, here's what we might like to diagnose you with.
It's lupus.
Yeah, they've got that anti-inflammatory disease called lupus. Oh no, maybe they've got colon cancer. Oh no, we'll just give them vitamin B12 and folate deficiency. Could be they've got chronic bleeding. Maybe they've got a GI bleed going on. Bone marrow. Maybe we should do a bone marrow test on you to make sure you're making enough cells.
Ouch.
Rheumatoid arthritis, sickle cell, iron deficiency, and there's more. I just named off some of them and says, here's why your red cells aren't in sufficient quantity in your body. And here you're going to tell me, oh no, by the way, Pam, all the way here I was going like that with your tube. Okay. I said on chemistry, yeah, it's easier for us to catch. Some hospital systems are more sophisticated than others. They have automation lines that run their chemistry tests. The automation lines on the hematology side, I don't have a hemolysis indicator yet. These, I know the chemistry for a fact do. But if you don't have an automation line, this is the way that the lab really sees hemolysis. We spin those tubes, we look at the serum, and we go, ooh, this one's normal, this one's slight, moderate, marked. You can have this and still have had some hemolysis go on, that it looks normal to us. And sometimes if we see this, we'll run it and see what we think. But I just took one. Here's a hemolyzed specimen. Here's a reference range over here of what normally you should run into. And so when you get a hemolyzed specimen, it's kind of like, oh, well, my sodium went down, my potassium went up, which is normal. The potassium's in the red cell. You've at least, let it lyse out into the serum. My glucose is up. That's normal because it was in the cell. Now it's out in the serum. Your ALT, your AST is elevated. LDH, elevated. Total bili, uric acid. So what does that mean? Here's the disease I just gave you. So when your AST is elevated, let's go check your liver, your muscle, and your heart. Your ALT, well, maybe you got some liver disease, cirrhosis going on. After last night, who was out till 2:30 drinking? If your uric acid's up, could be gout or poor diet. Total bili means obstructive jaundice. Your LDH being up is in response to cell damage in your muscles. So, and all this could have been was, once again, you didn't transport it right. because the red cells don't like to be hot, they don't like to be cold, they want to be cushy, nice and soft and taken care of.
That why my blood tests are out of whack all the time?
Were you downstairs?
Yeah.
Telling on himself. Yeah. So, as I kept researching this, it was kind of like, wow. Here's a lot of the ways that the internal hospital's courier system runs. I'm not too sure if this is the way you run, but honestly, they got a clipboard. Larry called. Pam took the message. Got CBC to pick up. In Dr. Williams' office. I called Tony. Well, Tony, go get it. It's now 2:45. Pick up the phone, Tony. Go to Dr. Williams' office. Go pick up that CBC. Click. Seriously. I'm amazed that we get our stuff anyway. There's a smart way out there, though. So if you're not going to communicate, you can communicate even better because there's dispatch systems out there. Where's he at? Sell your stuff. You need to know the neighborhoods and the routes. Online system to order stats. Oh my goodness, if you could get rid of the phones ringing in the laboratory, we would love you. You can check back on where the specimens are. So we're going to pick up the phone and say, I know we called for that stat 90 minutes ago. Probably was 90 minutes ago, but the doctor's called us 3 times since then, just so you know. And we're going to ask you where that's at. And then you can maintain the physician routes as they're added or lost. You're going to see a lot of that happening now because I told you earlier, people are freaking out right now with Obamacare. They are buying stuff, they are building stuff, they're trying to create all sorts of stuff to keep people out of the hospitals. I don't know if that's going to work. You can rearrange the routes to be productive, and you know where the specimens are at all times. This is a big win. Lab would love this. We know where it's at. And then you can change pickup times. So we've had that happen. Dr. Williams is on a 3 p.m. pickup route. He's going to leave early for today. He's going to go play golf with his buddies. Then you come at 1. And you should be able to just do that, just so you know. Because he said so. Yes, I'm telling you, it's all good to me. Then you have a Courier, there's Courier software solutions. They actually will streamline your process for you. They ensure that you have reliability and accountability, and most of them that I looked online, they're pretty easy to use. It's pretty intuitive. You can manage your whole delivery system, and it can integrate with other components. And then the level of expertise and the performance that's going to actually have to come out of your groups is going to have to rise as it comes with our group, because the expectation bar for us just went here. This is what we want in the lab, just so you know. We want integration. We would love for you to pick it up and order it for us. We would love to be able to call your dispatch and know exactly where that specimen is and when it's coming. And that goes into the tracking, yeah? That you can give me timeline of when it's going to actually hit my lab. That you can actually come back and do some kind of reports for us, like maybe how many specimens do you pick up from this physician? What kind of specimens do you pick up from that physician? So we can actually start building like databases of workload. Really, it really is all about me, just so you know. That you have a geographical footprint. We can see where our business is. It's on the west side of town. Maybe we need to go out there and do more of our marketing on the east side of town. We can actually see a virtual, this is for the big 160, I told you 160 hospitals, HCA, I know it is. A virtual nationwide network of where their work's at and what they're doing. And then this is one of the things that we really helps, because we can actually plan our workload based on what you tell us is coming in, and we can staff accordingly. That's where you got into, if you can show me this, other ways where I can win, then you're into other dollars. So you may be 50 cents more on this stuff. You just saved me a med tech salary of about 30 bucks an hour. If I can tell that person, I'm gonna put you on variable staffing, not gonna need you today, go home and take vacation time. And then, of course, you can reroute your drivers, which we would love, because we've had that happen. Ohio does get snow, sometimes lots of it, and they'll be stuck on our freeway system. And with all the other traffic going, I can't go anywhere because this tractor trailer jackknife.
It sounds to me that you want to do lab stuff. You don't want to be in the courier business. Even though you have courier business, and it's nice you can control them, tell them to go get mail, but you don't want to track your orders. You want someone else to do it. And that's a great thing, because that's what we do. You guys are labs. You give your stuff out.
I'm going to tell you why.
Well,
I
I know
wanna do it.
Oh, I know what's coming. I know what's coming. But the other
I
thing,
told you I thought about this. I said, what can I say about couriers? Oh, yeah, I can.
the other thing, like you said, you want us to be able to tell you what we can do or can't do, so you can staff accordingly. That also works the other way for us. So when they tell us, hey, we got some routes coming up next week, and then they don't call us, so we don't get everybody. And then, oh yeah, so we always have to. It works both ways sometimes.
Oh, I know, but I showed you, but we're the tin cans.
Yeah. Oh yeah.
And I'm going to tell you a reason soon why we are the tin
A lot of
cans.
I
times,
have a quick question. I just want to know where the negligence is. We make a pickup at an office. The
Don't shoot the
reception decides to put 12 specimens in a bag. Is fair?
Mhm.
We're responsible for that bag or what you put in the bag. And it's,
Depends on your customer.
I think it's going to depend on what actually happens to that patient. Everybody that touches is going to be liable. I'm going to tell you right now, if something happens, you're all liable.
But
Now, I
you
know
know-
who they're going to come after. The people with the money. They think the hospital has the money. So we'll be up there with you.
but there's the lost specimen right there. Did 12 actually go in the big bag? We don't know. There's contribution negligence everywhere.
Right.
On the pickup side, on the courier, on the transport, at the delivery side. So-
That's why you need chain of custody. You need to have that, you need to make that person giving you those specimens responsible by signing off
I'm with
that
you.
there were 12 specimens in that bag.
That's why I want it to get that, I'm telling you, you have to get this sophisticated. And the problem, well, you're gonna have better precision. It's gonna be more accurate. You're gonna be more cost efficient. And every time we recollect somebody, not only you can lose that physician office, you can lose that patient to never come back. The hospitals are in the business of, we want to take you from cradle to grave. I'm telling you that those are the buzzwords they use. You're sitting there going, wow. But they want to do that continuity of care. That's what we want. And so this stuff has to work, or we're not doing good care for you.
What is your percentage of bad courier deliveries?
It's really pretty low. I mean, it's probably 1% to 2% tops. That's what we talked about last night. I can't remember who I was talking to, but really, because it really does so well, I don't think there's a huge push because they've got all this other stuff happening to go, oh, the courier's broke, let's fix it. The courier's broke, let's fix it. The courier's broke when you lose something. And it's broke for that day till we repair it. And then a lot of times you're doing this customer service back to them to recover that account. And we're pretty good at it. The hospital's really good at saying, I am so sorry. It will never happen again.
Well, I mean,
Like that.
people get thrown under the bus all the time.
Right.
You know what? It's the courier, and then you look at us, and it's not our fault. But we always have to be the bad guy.
But you have to
it's
stop
different.
that because the patient really doesn't see that. That sounds good.
Oh, yeah.
They don't see that. I'm telling you exactly the way it happens. You may be my courier, they call me. It's not going to do me any good to say, that nasty courier did all this bad stuff. When he gets there, I'll take him out back.
Yeah.
Because they're going to look at the patient's going, but you hired him.
Yeah.
See, that's the blame game. It has to go
Yeah.
away because you all look stupid.
Yeah. Well, I'm gonna tell you what.
If they haven't learned that yet, I'll give a speech on that. I'll give you my card at the end. I'll go
If
talk
a
to
lot
them.
of companies, courier companies, run their business like some of the lab places, we would be. There are so many. If we make one mistake, they make 10. I'm dumbfounded. I was like,
That's the 2 tin cans.
yeah. It's
Pam, can I add something to that?
Mhm.
I've seen, in my experience, to ask somebody, I've seen a couple different ways. Because if you're just transporting like from the lab, customer, like a doctor's office that drew a couple vials over to the lab, that's handled differently than the guy who's using the I-8 and putting it on a passenger aircraft and
Oh.
sending it out. Two
Yeah.
different animals.
Yeah,
So
I'm-
the
You're answering your own questions.
The accountability there is like, well, we got 2 vials going, you know, over to the lab versus now we got 1 refrigerant, 1 ambient, 1 frozen, here's your label, here's their name, here's your manifest, blah, you know, it just goes, there's several different schemes of things that these guys use out there.
But you have to understand, I think, and I am gonna get that square. This is all you do. This is not all we do. A physician office, a clinic, whoever you're picking up from, that's not all that they do. They do all this other stuff, and the courier's just another piece of it. And so, if they're not doing it a lot, they're not gonna do it very well, I think.
Failure at the doctor's office is much more common than lost specimens by courier. I've seen historically in my business, getting there and the doctor says he sent the test in and 2 days later they find the vial still sitting in the refrigerator because
Right.
they didn't bag and tag it and give it to the courier.
How do you feel about that, Pam?
I think that one of your biggest problems that you're gonna have to overcome is the physician offices, because it really is one of our biggest
And then
nemesis
we
as
leave
well.
you
They
guys
bring you in the
Yeah.
work, so
No.
it's a tight
Train, too.
walk, because you really don't wanna offend them, but somehow you're gonna have to do that education with them. And I want it to be more of a, instead of us versus you, it needs to be an us and us for the patient.
Yes, who's the ultimate customer?
And that's what Ken
Right.
sells here.
That's the ultimate customer, that's paying all the bills.
I mean, Mayo Labs has one of the most sophisticated specimen tracking systems out there, and yet if the doctor's office doesn't put a specimen in the bag,
It's not-
it'll take Mayo about 48 hours on their end to realize they didn't receive the specimen. As good as they think their specimen tracking is, the person who's in charge of looking for missing specimens isn't real life.
They haven't gone out far enough though to me.
He's in
I
St. Louis.
know there's technology out there.
Right.
I want the expectation that you're going in with that handheld device to that physician office and you're scanning and you're barcoding those tubes right there. You have, there is that capability out there
Right.
that you can actually then protect yourself, because guess what? You can do proof of delivery. I
Well,
picked it up and I delivered it. Now
They
where is
scan the
it?
bag, they don't scan the
At a
individual
time
vials.
to-
There you go.
Yeah, so
Check
there's
out about
your-
the
two loopholes you talked about?
Exactly.
The
And what Larry said
opening
is exactly right. You get a bag with maybe 12 specimens in there. Do you
Or maybe
count that
50.
there's 12?
If you can, yeah.
Yeah.
If you can see them.
And if,
That's if you don't want to be.
Well, sometimes there's 10 specimens, you get there and there's 50.
Sometimes they're
Hey,
even
sometimes
50.
one lab thing is 3 vials. You don't know
Here's what
that.
they're trying to do.
And that's one point. That's when you're picking up from a live person. Let's take that same scenario, and you go to the lockbox or the box because the doctor's playing golf.
Yeah.
Now they think they put 12 in that bag, and there's only 8, and we still have contribution negligence.
Now,
We
see,
lost 4.
or me, the hospital lab's me, 1 patient per bag. They are doing that to you because biohazard bags are expensive.
Okay.
But you can if there's a
I didn't Google that, but you
can't
can
have
do
a
that
vacuum.
after, okay?
12 bags though.
If there's a panel.
I
then-
understand that, but we run around in coolers, you guys. I can only do it from my perspective of what we're doing.
Yeah.
We made them every patient in a different bag. That doesn't mean that the slip they put in there matches the patient they put in that bag. No.
Or that they put the vials at master.
Or they write I was looking at you and I wrote your name on the tube.
Human
Yeah.
error. Yeah.
Right. I don't know if you ever get rid of that, but you're gonna have to find a way to minimize it, because the problem is your resources are going down. We're not gonna have more money, people. We're gonna have less.
How do you approach that when that happens in your lab? When you see it, when it comes in, when there's 12 specimens in one bag? How does the lab look at that?
Are you talking about a batch bag, or are you talking about one individual biohazard bag?
Just one bag and there's like 12 specimens in it?
There could be that many specimens required for the panel that's being, the test that's being ordered.
Correct.
So there'll be
When
more
we're-
than one.
Our
tube.
outreach, no, we're not taking it that way. I'm not gonna say that they haven't done it. We'll actually match the slips in the tubes and probably call them back and say, no, we want 1 patient per bag. On the floors, in the morning for our morning rounds from the nursing floors, oh my Lord. I mean, they're just throwing hundreds of tubes down in there at us because they're drawing the whole house for the day. I mean, we're sorting those tubes based on what they're saying that they're giving us.
Yeah, I think a lot of the places that, and me in particular, that I've picked up in the past, they need to be retrained. The doctor's office, because they're like, oh,
That's your next
go.
thing.
There's some
I'm telling
facts
you,
there.
Ken.
You put them in the bag. You go around and get them.
That's what I-
They have the courier do it.
If
And I
you
was like,
feed
well,
the
good thing I-
doctors,
good
they
thing it
will
was me
again.
here, because, you know, the driver may not pick up the dispatch and say, hey, you know, I feel uncomfortable doing this. I mean, it's, yeah.
I don't have a watch on. Am I really
Go ahead.
running over?
You're okay.
Okay, man. Good.
5 minutes.
Okay.
Take us home.
All right, so on the client management, this is what I want to. I would like you to, instead of using snail mail, just send me an electronic bill. I want all the pickups on there and all that good stuff sorted out. A lot of times my courier bill that comes, I have to sit back and it'll say a street address. I'm like, seriously? What is that? Is that McDonald's or what? Who is that? A lot of times, sometimes it'll be like, oh, so-and-so called. They don't have a name next to it. Like, who called you for that pickup? Because I don't even know where you went. So I just think it's, if you can actually do IT solutions and automate it somewhere, you're going to be a lot better off, because I know for a fact, the way we have it is the courier walks in, we have a book. You need to sign my book, that you're giving me something, and sign my book that you took something. Really? I mean, in the day that we can actually sit here and do all these phones and Skype people across the United States, we're still using, here's my clipboard. I don't know. And then you give a variety of management reports, which I already talked about. Now, Obama.
That's a different topic.
Do you like it? Yeah, here's why we're going to talk about that. So Obamacare came into play, and this is why I told you all the hospitals are like freaking out. Going, oh my God, what are we going to do? What Obamacare really is the Patient Protection and Affordable Care Act. It's a bill that was signed into law. It's already in law, and some of the stuff has already happened. Like you can, keep your kid on your medical insurance until they're 26. It's supposed to reform the healthcare industry. It's going to do something. All the insurance plans have to now cover preventative coverage for you. So if you need a little woman, a mammogram, covered. PSA for the men, covered. Routine physical annual, covered. It's going to have blood work that goes with it, lipids, TSH. They like to do your CBC and make sure now you transport it the way I told you, so you have accurate results. And it's going to stop them from having like limitations. 5 million, you're out. Because you can get to $5 million in healthcare really quick if there's something really debilitating wrong with you. Mm-hmm. And it's also going to stop them from dropping people. So you're sick? Oh well, I have to keep covering you. What it's done is, though, it's going to mainly cut reimbursement rates for insurances, hospitals. So they want to decrease the amount of Medicare that hospitals get for reimbursement. And the hospitals, I love this, this is right from the U.S. government site saying the hospitals agreed to this. I don't think we had a choice. Just so you know.
Just to be clear.
Where did you vote? Where did you vote on?
We voted on that?
I was like, oh, did we? Okay.
We have to sign the bill before we can know what's in it.
Right. So what they're saying, though, is supposedly we're going to see this large influx of patients into the hospital, and that's going to either let us break even now, or that we'll possibly make a profit. But we're going to save those taxpayer dollars.
Volume increases.
Well, but on the other hand, I'm getting ready to say, they've got this value-based purchasing that went into effect in January of this year. So what they've done is they've sequestered 1% of the Medicare reimbursement that the hospitals would normally get, physicians, clinics, everybody. Let me hold this up here in the kitty. Then they have 20 factors that they're going to gauge those facilities on, quantity versus quality. Now, they just said we're going to get more patients, right? Yeah. Okay. And so then they're going to grade the hospitals on these quality measures that says patients with heart attacks, pneumonia, readmittance back into the hospital, as well as your patient satisfaction scores, or just some of them. And it's actually going to be done by the Hospital Consumer Assessment of Healthcare Providers and Systems. I had to read that because we never say that in the hospital. We just call it HCAPS. So HCAPS is the one that's going to actually track all of these factors, and they're going to be up on the internet so you can Google how well we're actually doing. And then everybody's gonna know if you're gonna make money, you're gonna lose money. So the hospitals have a bunch of incentives to make sure that the employees know about this legislation, that we know about what HCAP is going to grade us on. Phlebotomy, quality control, patient testing, customer service, instrument maintenance, physician, blah. I wanted to make this really small, I wasn't sure you could see it. I was gonna make it microscopic. There you go. Yeah. So, that's why I said when I was thinking, when Ken was saying, I said, what do I know about surgery service? There it is, right there.
This is fascinating.
Well, anyway, this is why I would love to be out of the business, or you gotta partner with me. And when you partner with me, that means I really want those things I told you. Where are my specimens at right now? How many do I have coming? Email me my bill, and I know who you picked up, Dr. Williams, the date, the time, whatever.
Pam, how often does your company go out to bid?
Depends
I can't.
how many times they lost the package.
That's purchasing again. I don't really know. They'll usually ask us when they said, have you had any major issues with them over the years? So a lot of times we won't do anything more than a 5 year. That's about our longest contract that we'll do. Some are 1, some are 3, some are 5.
Pam, if you're getting beat up by the courier service, you're gonna change it. You're not waiting 1, 3.
We've already done that. We've changed courier.
There you go.
So who controls?
And we've changed couriers to get a higher one when the ones that was doing our routine stuff didn't deliver. We brought another one in. So here's where I see it going. You're going to have to do those IT solutions because you've got those tough performance standards that we have to meet. And we need manager expertise to run the program, not this manager. I already showed you where it was on my list of to-dos. And then look at ways to reduce costs and maintain that quality and integrate our services, not us and you. It's got to be we. So when you go out there and sell yourself to the CEOs and the COs in purchasing, here is the buzzwords for the hospitals right now. On this healthcare initiative, they're all worried about this. So I want you to put these in your presentation for your marketing. I'm going to say, you're going to go up there and you're going to go, we're going to think lean, and here's the Kaizen approach of what we're going to do. Kaizen approach is, here's what I'm going to implement for you. I'm going to come back for you in 2 weeks and check it. If it doesn't work, we're going to make the change that day so that you're making your turns very quickly. Not go, I'll come back to you in 6 months and make sure everything's hunky-dory. PDCA, plan, do, check, act cycle. Here's the plan. Here's what we're going to do. I'll check back on this time. If we don't like it, we'll act on it, or we'll react and make it better. TQM, total quality management. CQI, continuous quality improvement. 6 Sigma, here's what you want to do. Bottom line, all I'm telling you is, I want you to tell me, tell the hospitals, tell the doctors, how you add value. Quality, safety, service. What are you passionate about? I am. I showed you that red cell. Anything else you want to ask me, you guys? I know we ran over because we got talking.
Pam, you're fantastic.
Thanks.
Let me tell you a little bit about how I got into the world of medical deliveries. Back in 1992, 93, I started a bike messenger business in Boston. I ran that for a couple of years, sold it, finished up college, and then fast forward to 2005, I worked for MediFleet, managing a lot of their New England routes, a lot of their hospital outreach programs, and working with their couriers. And then in 2009, I was offered a position with Strata Pathology in Lexington to manage their in-house drivers. So I think part of maybe Ken's idea to have me come out and speak is because I do have that unique perspective of not only working with a medical division of a courier company, but also working inside a lab and knowing how those relationships work. And maybe I can provide some insight. So when I first got to Strata, It was kind of a hodgepodge, operation. They had about 5 or 6 in-house drivers. There was nobody really managing these guys. They were kind of running rogue, doing their own thing. They had very little training, so I had my work cut out for me for sure. A couple of years ago, Pat Nolan, my CEO, he came from LabCorp. He said, I want 99% of everything within a 60-mile radius of this lab done in-house. So we need to beef up our in-house driver network. We doubled our staff. We've done a lot of things to improve our services. From a technology standpoint, we invested in a small fleet of cars back in February. We have about 6 2013 Ford Focuses, which has been great. We work through Enterprise Rent-A-Car. They're one of the only companies in the nation that will do a fleet management program with 15 cars or fewer. So it's kind of hard to find. We weren't looking for more than 10 cars. It's come in real handy with the GPS tracking systems. They're all equipped with like a black box, if you will. I'm sure a lot of you guys are familiar with this. Comes in real handy. I had a situation the other day. One of my lab aides kept saying, why is this guy coming in an hour late, like later than when you guys do it? So it prompted me to check the GPS history. I went back about a month. Every single day from 4 to 6, he was at the exact same address out in Worcester, Mass. Doing what? The beauty of technology, Google Earth. What is at that address? Gold's Gym. The guy's bringing my specimens in late because he's, working out at the gym on our company time. So that's where it comes in really handy. So today, what I think, we're going to go over is the role of the medical courier at Strata. Communication, cannot stress how much, communication plays a role in logistics and most costly mistakes that we've seen in our ideal business model. So timeliness is critical for diagnostics. What we do at Strata is predominantly we do dermatopathology, we do oral pathology, and cytology. So we're testing for cancer. You can imagine, I think everyone in this room has been affected in one way or another by someone who's suffering from cancer, is in recovery from cancer, or who's unfortunately died of cancer. So getting those specimens into our lab in a timely fashion is critical. I mean, it depends on what type of treatment is going to be administered to that patient. Knowing that information, the sooner the better. So obviously a lost specimen, a late specimen, something that doesn't come in on time affects it like a domino. It's specimen accountability and documented procedures. I talked about when I got to Strata. This is what we were talking about earlier with I have an exact example. We came up with a standard operating procedure that is a multi-tiered option. We call it our platinum version, which is where it's a specimen logbook. So it's like a three-ring, not a, what do you call it, velabound. And the patient's name is listed with the number of biopsies that are attached to that patient. When the driver gets there, he can look and see what's on the requisition. He can see how many biopsies are attached to that specific patient. They both sign off on the bottom, date it. It's a carbon copy. The top sheet gets torn off, puts into our transport bag with the specimens. That is in turn put into the cooler in the car, it's brought into our lab. When it gets into accessioning, they open up the transport bag, they pull out that log sheet, they see exactly, they can cross-reference, reconcile, see exactly what was picked up was brought in and made it to the lab. The other form we have is a voucher system, we call it. It's like a spiral bound book, 3 up on a page, they're like bill of ladings. This worked real handy with Larry, one of your guys, out of Manhattan. We had a client call us and say, this is exactly what we were talking about a half hour ago. Lady said, we sent you 13 specimens, but what we see is 12. She said, no, it was 13. We were able to revert right back to that voucher that the driver had that personnel in the office sign off on it. She said that they sent 12. We got 12. That's what we received. We called them back. We scanned, emailed her the voucher. She was kind of embarrassed. She was like, you're right. I did sign. We sent that to another lab. My apologies. But that's where that documentation comes in really handy, because we were covered. Because Larry's guy did exactly what he was supposed to do.
Thank God, because I didn't even know that happened.
Yeah, Rob.
How much time did
Larry,
you
that's
lose
why you
going
don't
back and
know.
forth?
The guy did it right.
We didn't lose any time, because it was like,
So
we
it was
just
a
pulled the
phone call?
voucher from that
Phone
day.
calls?
Yeah, it was
10
the next
minutes,
day.
something?
Right.
Because when you get a lot of those during the day, you got someone spending
Right.
5 here or a couple here. If it happens,
Right.
you're losing an hour a day.
Right.
Really,
Yeah, I'll talk about some of the mistakes that have cost like days of trying to lost
really?
days. So the standard operating procedure, again, when I first got to Strata, there was like really no procedure in place, and this came about because we did have a client, sizable client, say they sent us something. Our driver goes and picks up out of a basket he was writing on his manifest. So we thought we were documenting it. We were, but the client didn't tell us. They didn't submit a patient log. They didn't sign off on anything. They said they sent us something. I think you had said earlier, 9 out of 10 times, it's the client. That's happened, right? You lost our specimen. 3 days later, oh, my desk is so messy. We found it underneath a bunch of file folders. Oops. But it's so handy to have that documentation in place. We prefer the platinum tier, but we have certain clients that send up to 40, 50, 60 biopsies a day, and they don't want the tedious process of writing every single patient name. So what we do is that voucher thing where they just count. The driver stands next to the client, the person in the client's office, and they just say, this was 38, you got 38, I see 38, they write them down, sign off, it's done, it's torn off the thing, put it in the transport bag, and that's what we have. Effectiveness of 24-hour turnaround time, what we feel at Strata sets us apart from certain other labs, other hospitals. A lot of standard turnaround time for resulting in a biopsy is 7 to 10 business days. At Strata, we take a biopsy, the doctor performs the procedure on Monday, our driver picks it up Monday. Those results are reported back on Tuesday. That's pretty quick.
Alex, how many pathologists do you have on duty to handle that kind of turnaround time?
We have, we're a smaller lab, so the whole entire company is about 130 people, and we have about 20 pathologists. And 5 or 6 are at a satellite site over in Cambridge, because we offer a program through Harvard University where a lot of the residents come and learn from our doctors. So that's all oral stuff, oral pathology over in Cambridge. But it's a strain at times. You're right, Ken. It's a lot of pressure on the doctors to get that stuff out and be accurate. Again, it's all about patient care. Electronic tracking. Pam was talking a little bit about this. We teamed up with a company called PathTech. They are really, really good. What they do is they have this software that's geared specifically towards a Path lab or any lab. It's different from like eCourier or CXT because it's thinking about the needs of a lab specifically. So it does everything from supply inventory management. For instance, prostate kits. They will build our prostate kits to our specifications on their site. They will warehouse them. They will barcode. They will ship them out. We can do online ordering. The client can order direct. And then it's all, kept track of in the system. So we know if there was 20 prostate kits sent to one client, once they're scanned, they went out, we know what our inventory is. And we do specimen tracking. We developed the field form, so they customize it for you. We knew exactly what types of specimens we pick up, and that's what we wanted to be available to the driver when he pulls it up on his phone. All this is possible with smartphones, of course. We've heard a lot of that in the last 2 days. Smartphones are changing the game. I mean, it's unbelievable what you can do now with a smartphone. Barcode scanning, you no longer need a $700 scanner. I mean, the majority of what we do, I understand a lot of you guys are scanning high volume stuff, which I think you mentioned it's hard to do with just a smartphone scanning app. But what we do, up to 20, 30 biopsies, it doesn't take that long, and it's very effective. It's cost effective. So with PathTech, we can also track drivers. We can see where it's really valuable is our lab personnel can log into their system using their passcode. They can look at, let's pick a driver, Angel. Where is Angel right now? They can click on the map, see where he is using the GPS tracking. They can see how many specimens he's picked up, and they can see exactly what type of specimens he's bringing in. How is that useful? How is that helpful? They know for staffing purposes. Is it a light day for Angel? Maybe I can send somebody home. Is it a super heavy day? Maybe I got to add a staff member. I don't know. I mean, that information is critical. Before we had this, they would be calling me. Where's Angel? He's late. What's he coming in with? How many specimens does he have on board? Now they just log into Pathtech. They can just see everything in real time right on their computer screen. It's really handy. The next thing is communication. A similar slide, right, to Pam's? Drivers are the face of the company. I've talked about this with somebody else last night. Our guys are in the client's office, sometimes twice a day. A sales rep, they're lucky to visit a client twice a month. That's right. So yeah, they have a relationship. The sales rep has a relationship with the client. They got you in there for sure. But it's the driver that sees them every day. It's the driver that builds that rapport. And I got an email last night from one of the sales reps that I wanted to share with you guys because it is awesome to hear this kind of stuff. A lot of people have said, why don't you just, do away with all your in-house drivers, use an outsourced group, cost reduction. Where was this email? Hi Alex, Tracy, office manager at Dr. Washburn's, wanted to pass on to Mustafa's manager, that being me, that he is absolutely wonderful. They have never been so impressed by a courier. Will you please let them know? That's the kind of stuff we love to hear. It's Mustafa who becomes like practically a family member of these guys. They love him. He treats the client like they're his own, and that's what that level of customer service. That's why Pat, when he came on board, said, I want all in-house drivers. And that is no attack on an outsourced courier group, because I know there are superstars that work for you. You know who they are. They do a bang-up job, absolutely. But I have a real hard time sort of managing an outsourced driver. I can't train him. I can't tell him what to do. I can't reach out. I have to go through a dispatcher to find out where he is. It makes it difficult. But where you guys come in for us is we are in a lot of states. So obviously 60-mile radius, pretty limited. So we partner up with a lot of guys like you. We're in all over Kentucky, Illinois. We're in New Jersey, Pennsylvania, New York. We're all over the place, and we need to partner with you guys to make that work. The drivers receive valuable client information. A lot of times the driver will call me up, hey, I just saw LabCorp in there. There was a LabCorp driver. You might want to alert the rep. Maybe it's time for them to do a luncheon. Or they say, we want to change your schedule. We don't need you here 5 days a week. How about 2-3 days a week? That stuff goes directly to the driver, and then, they're the first, they're in the trenches. They're in the...
Guys, honestly, I was a courier for 20 years with SmithKline Beecham. Couriers are the eyes and ears of your outsourced labs as well, and he's saying valuable information. Don't allow your couriers to shrug that off and say, I don't know. What they should say is, I'll pass it on to my dispatcher, that my dispatcher will contact the lab client and let them know. It could be supplies. We're out of specimen bags. We don't like something that's going on with the lab. Even if they grumble, drivers need to be listening and attentive, because that grumbling starts and soon you lose a client. Oftentimes the courier can pass that on to the lab client. It's going to retain that client for them, and it's going to retain the business for you. Couriers need to pass on that intel. Really important.
Yep. It could be something simple as a supply order. Hey, I need more bio bags, to something more important. The doctor's going to be off the next week or whatever. It's really critical that we receive as much information as possible. Mistakes, which is a segue into my next part of the presentation, starts with a lack of communication. And I pulled a lot of all these mistakes that I'm going to talk about. Every single mistake that's made by a driver in-house or outsourced is documented. So we put that into our quality management core data. It's shared every month at our management meetings. So I've heard some people say, we at so-and-so courier company, we make one mistake, it never happens again. Really? Do you want me to go back and pull my core data and show you where that's happened multiple times? So, It's, you know, this is one of the most common mistakes I see, where the driver does not know who they're representing. I understand it from a courier company perspective, because you guys use all kinds of different drivers that deliver for different companies that deliver different things. So if you get a call for a pickup and you have a driver that's in that area, you're going to send him in, but somehow the information didn't get relayed to him that he's picking up for Strata. And this has happened where it's a brand new trial client for us. They're just testing us out for 2 weeks to see how we do. It's their first pickup. The driver goes in, I'm here to get your specimens. Yeah, okay, we use 5 different labs. Who are you picking up for? I don't know, I'm just here to get your specimens. Do you have them? Okay, that does not leave a good impression. It sounds like common sense. The driver should know, but it happens all the time for some reason. They gotta know, just the dispatcher, can you do this pickup for Strata? Announce when you walk in, I'm here to pick up for Strata. Easily avoidable, but go ahead.
That happens sometimes when the dispatcher doesn't get the information from the client. And
right.
They should always relay be adamant about delaying to the driver, but sometimes they don't get all the information.
Right.
And stuff slips through sometimes.
That's right, it's not on the delivery alert.
Yeah, well, I mean, for us, it's always going to be for Strata, or I wouldn't be calling you. You know what I mean? Like, hey, can you do a pickup for us? You wouldn't.
And like you said, a little bit, sometimes a little extra information helps save it.
Right.
Hey, this is a trial client. We give a little extra.
Right, yeah.
If they have
Give
that,
the white glove
if we
service.
have that stuff,
right,
then we can.
Right. Or
say, hey,
it's a
we're
brand
on top of
new, high maintenance client. Can you please do me a favor, send in your best guy?
Exactly. Yeah, but again,
you know what I mean?
Communication thing.
Right. It's
Help
communication.
you.
It's paramount in this business. It's everything. But for some reason,
stuff slips through. Yeah.
It does. No key to the lockbox. We do the best we can to all our outsourced groups to get them all the keys. This has happened a couple times. Driver gets to a lockbox, can't open it, he leaves. It's in my standard operating procedure to say, take the whole lockbox back to your headquarters. I don't care if you smash it. It's a $42 lockbox. That biopsy, we need that biopsy. Just do whatever you got to do. We'll replace the lockbox the next day. It's not a big deal. But don't just leave it there. Oops, I can't get in. Oh, well, too bad. And the guy's on his way.
What if it's attached to a building?
What's that?
What if it's attached to a building?
Attached to a building?
Yeah. You bet.
Then you get your crowbar or your tire iron out of your trunk and you smash it open.
Okay.
Yeah.
Combination locks.
I haven't seen the lock boxes we have are it wouldn't take a lot to open it.
We have clients combination,
Yeah,
and it
yeah.
works out great. It really does, instead of carrying a bunch of keys.
Right. In the rare instance, this did happen to one of my in-house guys. It was a door-hanging lockbox. He did not have the key. It was inside of like a medical building, and it was during hours. The office itself had closed, but there was people walking around. He called me and said, Alex, what do you want me to do? I'm not going to start smashing open a lockbox inside this medical building with people coming out of offices. I said, unfortunately, you're right. We got to notify them in the morning. The driver didn't have a key. There are rare instances that will happen.
But communicate.
So in this situation, what happened was the lady put the stuff in the box on Monday. They went back out on Thursday, and she opened the box, and the stuff was still sitting in there for Monday. Total disaster. And that was a new client that never used us again.
Oh.
So they don't trust the integrity of the box anymore. Did the courier?
Right. Oh, we have a lot of clients that just flat out refuse to use lock boxes.
That's right.
My CEO hates them, but on a snowstorm, we were talking about this earlier. The doctor's going to play golf. Well, in a snowstorm, everyone's jetting out of the office hours early before the monsoon comes or whatever, and they say, well, can you come pick up? Well, the lock box or whatever. They're saving grace in those instances, but we try to do live pickups for the accountability reason, just so you can say, well, Betty at the office, she handed me 16 specimens. She signed off on the voucher. I have her signature. Case in point with New York a couple weeks ago. That's where that happened. Unsealed FedEx clinical packet. This is where I spent 2 days trying to research a lost specimen that fell out of a clinical packet.
Dealing with FedEx?
What's that?
Dealing with FedEx?
Yeah. They are such an enormous company that they're really hard to deal with.
And sometimes they don't care.
I mean, I just don't think they get it.
Well, yeah, it's
But they have a thing where they aren't, I guess it's part of their policy that everything that's brought to their counter should be sealed, air bill attached to it. They are not responsible for sealing anything, putting anything in it. It should be prepared, ready to go. Couple of different times, unfortunately, we've had it where the biopsy, the box slips out of the clinical pack, it's unsealed, the clinical pack is unsealed, and then you have this floating box with somebody's biopsy in a facility somewhere. You hope it's recoverable. This has happened 2 or 3 times. Every single time we've recovered the biopsies, thank God. But it goes into some holding center at FedEx, and then you got to put a trace agent on it. I spent the better part of 2 full days trying to track down this situation where if the Courier had just sealed the stupid clinical back, the whole thing would have been avoided, and it was a lot of lost manpower hours. Pick up from the wrong box. All of our boxes are labeled. They say Strata. The logo's right on there. I said earlier we don't test for blood. We don't do blood, but we had a driver go into a lockbox and pull out something from Quest, I think it was, and send in a whole bunch of blood vials to us. And we were like, wow, this is not for us. That's a red flag. So attention to detail, I would say. You got to pay attention to what you're doing. This one's a little complicated because, what I'm referring to here is that, we're paying an outsourced courier company to go to a location. Okay, we've seen this. We're invoiced for it. We're paying for the driver to go there. Well, he's gone 2 weeks in a row and hasn't picked up anything. It might be 20, 30, up to 40 minutes away. He's like, I think I'll just call them and see if they have anything. Right. So the philosophy from the sales rep is this. I guess it's like, if you build it, they will come. Meaning that if he sees a Strata driver every day going into the office, that will somehow prompt them to start sending to us. It's sort of like presence. Like, the more often they see the Strata driver, that it makes them feel comfortable, and maybe eventually they will start sending. But what I don't really like is not knowing that. It's okay for me if it's arranged or the client's okay with it, or we know that we won't be billed for it. That's right. But when you're kind of doing that without telling us, like calling the client, and we get calls from the client saying, this guy's been calling every day. Is that okay with you? Like, is that an arrangement you have with them? And so that's.
Can I touch on that?
Well, Alex,
I'm confused with these.
That also gets initiated by the client more often, and you don't even know your driver's doing it.
Right.
Until the failure occurs.
Right. On the other right.
And that,
right. That's where communication comes in. Just hey, the client just told me not to come every day, and you're right. We've seen that before.
And we've eliminated that on some routes because you can implement with barcode scanning that they have to do a location scan.
That they've been there.
And it proves
right.
that
they went to that
physically
location.
went into that
right.
location.
Right.
And I wish you could say you could trust every driver that you ever hired to do everything,
I know.
But it doesn't happen.
Right.
Or
right.
it's 45 minutes out away and they're paid.
That's right.
That's 45 minutes
I
less.
have to say something kind of important on that. Now, when you have the driver calling Susie, hey Susie, is there anything?
Yeah.
No, don't worry about it, don't come. Done. He goes on to do something else. They drop the specimen off, it's on demand or whatever. They drop it off. Oh, did the courier come in? Oh no, Susie's throwing him under the bus.
Right.
Oh, did
That's
the courier
right.
come in? No, he's not here yet.
That's a great point.
He didn't come. Yeah, I mean, you're getting paid to go there. You have to go there
Yeah.
for nothing or for something.
Right.
So when Susie does with him, then after that, something happens and he's never going to make it.
Right. And that's what we like in those electronic PODs where we get, it says no pickup per Kathy. Oh, they know. We have Kathy. Kathy said there was nothing. So that's handy. Mixed FedEx cutoff time. I talked about our turnaround time, how critical it is. I talked about how vital it is to get that stuff in on time. Last night I'm upstairs listening to Dan. I got a phone call from my colleague back in Lexington. I said, what's going on? He said, well, we had a call in and I didn't see the POD on it. So I called the office, the courier company, to see what happened with it. They said, oh, well, we got the specimens, but we missed the FedEx cutoff time. The call came in at like 6 o'clock. They have till 9 to get there. I'm not sure what happened yet. I'm going to get more of those details, but why that's critical is because, okay, that's Thursday night, right? Today's Friday. We're not open Saturday and Sunday. We're not getting those specimens till Monday morning. Can you imagine the delayed timing that patient is going to be waiting for the results?
It's huge.
So a lot of courier companies say, "Whoa, we missed the FedEx connection. You know, we'll get it to you tomorrow." No, that's not good. Arrive too early, you know, on the schedule. I think you were just saying this. It's 6 o'clock pickup time. Driver shows up at 4, leaves. Lady comes out, puts stuff in the box at 6.
Yeah.
Sits all night into the next day. She comes out. Why is my stuff still here? What happened? Well, the guy went way too early. Incorrect. I mean, this is some basic stuff. Wrong location. We have offices at multiple locations. They go to the wrong location on the wrong day. This actually happened. A job was dispatched to a driver that was no longer at the company. I thought that was actually kind of comical. Real quickly, our ideal business model and what we've been able to do with one of our routes. We run a line haul, so one of our in-house guys drives down to Connecticut every night and meets up with one of Larry's guys, RDS. And originally, when I reached out to Larry, I said, we're kind of thinking out of the box. We had a lot of issues in our New York market. Just since Hurricane Sandy, just everything was a disaster. I said, all my sales reps were like, why can't we have one of our in-house guys in New York? And I'm like, do you understand how complicated it is to manage an in-house driver 150 miles away? I can't really do that. So I have to partner with one of you guys. But how can we do that and kind of have a perfect marriage? So Larry and I got together and we started thinking about ways to make it work. And Pat, my CEO, said, can we have the guy in one of our uniforms and use our SOP and train on our systems? And we've been able to do that. I will say RDS is phenomenal with communication. LaToya in his office is just great. She calls anytime there's a little thing. We've been doing this for about 3 months, and we, knock on wood, have not had one single hiccup.
Nice.
I think it's all about how we set it up. How it works. I mean, seriously, it's amazing because every time there's another issue with one of these other mistakes I've outlined with another outsourced group, it's like, wow. I mean, it's really impressive. And then I'll wrap it up. Similar to what Pam was saying. I mean, I can only speak on behalf of Strata. But I've had conversations with Pat, and I've talked to my sales reps, and they're like, why isn't there like an upper tier service for the medical division? And I said, it's not like the cab industry where in Manhattan you can flag down the yellow cab or get a Lincoln Town Car with a guy in a suit. Yeah. There aren't really those two different services. And why, I don't know, because I cannot hammer home enough times. This is patient care. We're not delivering pizzas. It's not auto parts. These are human biopsies. The stakes don't get any greater than that. They really don't. So it's befuddling to me that when I came into Strata, it was like, what are they? Our guys get paid pretty good, but some of the new guys, Pat was like, we're going to pay them, much less. And I said, I reminded him that, you get what you pay for. So what I was going to say is that I think that if somebody came to us and said, we have a system, we can get you a $10 or $11 an hour driver or whatever, hypothetical, that is, a decent driver, or we can have a guy that's trained on medical specimens. He's trained, he's got tons of experience in the business, he knows what he's doing, he's articulate, he's professional. Yeah, we'll definitely pay more for that, absolutely. Why? Because if I could do a cost analysis on the amount of business and clients lost by a guy going in saying, specimens, here to get your specimens, or a guy that walks in and says, hi, I'm here for Strata Pathology Services. Or, can I grab your biopsies? We're going to bring them into the lab. It sounds like pretty common sense, but if we were able to have that and know it was an option, I know that we would be willing to pay more. I'm not saying we have money to burn. I'm just saying that we shouldn't be cutting corners when it comes to this type of care, patient care. That's what we're delivering. So hopefully some of what I said wasn't so redundant that you were nodding off. Any questions you guys have? I know we're running real tight on time. We can exchange business cards. I know Ken is working on a database with all our emails. We can do it that way or whatever. So I don't know if there's any quick questions.
5 minutes for questions? Do we have 5?
3 minutes.
3 minutes for questions.
You use FedEx a lot? I mean, is that your primary?
We use FedEx a lot. We do, because what we do is, some accounts will have the FedEx guy go right in, but I don't know if you all know that FedEx will not pick up out of a drop box. Partially because they don't have a key, but mostly because I don't think there's a person there. And they will not pick up out of a drop box, that's one thing. And you can't pinpoint their scheduling in most cases. They give you a 2-hour window.
No.
We have a lot of clients that are like, we want a 5:30 pickup, 5:30, not 5:29, not 5:31. And it's like, okay, you can't really do that with FedEx. But yeah, so we have you guys go into the client and take to FedEx. And then you will package in the car, you will do the whole primary, secondary, tertiary absorbent material, the whole bit. And then it gets into what Pam was talking about, classifications and all that. But yeah, so we do use FedEx quite a bit.
Your lab doesn't operate like through the night?
We are 24/5 or we're on the weekends we're closed down. So I'm super spoiled. We also, most of everything we do is room temp. So I do not need to worry about dry ice. Thank God. That adds some serious logistical challenges. And yeah, we're done Friday night.
But the lab works during the week?
At night. So everything we bring in on like Monday night is processed overnight. It goes through grossing and processing, and then it gets transferred to the slide that the pathologist looks at, and then the reporting is done. And our guys will take the hard copy reports. We have a lot of clients that like the pictures. We do the photographic images on the reporting itself of that, what exactly they're looking at.
You should consider using commercial airline or maybe AirNet, because you'll have much quicker turnaround time to get the stuff out.
We are actually, as we speak, exploring that option with AirNet because a lot of out of state, we're trying desperately to make that FedEx cutoff time, and it's usually around 7:30, 8 o'clock. Well, if we were able to show up at AirNet later at 10 o'clock, it's
AirNet's very reliable. It's runs Monday to Thursday.
Yep. So we're actually exploring that method.
Yeah, Express Air is pretty good too.
Yeah.
Being an independent lab, are you finding out of network issues since the beginning of the year? Where
huge. Well, the Medicare thing.
Medicare.
That was devastating.
The blues and.
Yeah, it is everything that Pam talked about with the Obamacare and the healthcare reform and everything has affected us for sure. And primarily where we've seen it, the heaviest hit was in Medicare. Okay. Because so I think Keith was talking about a lot of that. There are a lot of things covered under there, but it was a huge hit that we took on that.
So if we listen to you, we listen to Pam, really what you're telling us is raise the bar and we'll pay more for it.
Well, if you take into consideration, hypothetically speaking, a potential $300,000 a year client, the driver walks in, has no idea who he's there, who he's picking up for, and they're saying we're going to stick with LabCorp, we will use CBL, we'll use someone else. That's a big loss. So if you were to say we'll send a guy in, and on the back end, it might cost annually $20,000, $30,000 more. I know my CEO would agree to it for sure. That's why a lot of people have come to us and said, we can save you so much money by doing the whole thing outsourced. Pat's like, I don't want to hear it. Because I know that my in-house guys, where they're micromanaged by our manager, doing our systems and our uniforms and all that, it's just been more effective. And I think that's where it makes sense is when you jeopardize client relationships based on, because the driver is so valuable, so critical to what we do, that when they
where you get the manager consistency or your accountability.
What's the question?
No, I was saying only as a comment to him, you get to manage your accountability more when you have the guy. Just like I do when I have the IC. I can have a little bit more say-so right there with him.
Right.
Where, if you have a guy that's working for you like he has, you can pretty much tell him everything. He's an employee.
Right.
So like she was saying earlier, that if you build and grow, you're stuck in treating your own guys and do that. You're going to have to use us for the new clients and stuff like that. Mm-hmm. And you're in the lab business, not the courier business. Mm-hmm. And we all understand that you have to have a certain amount of control, and it's nice to do that. But then you're dealing with cars, and there's a cost issue, and you have to find that balance. I mean,
But
that's
I'm gonna share one little nuance. What really works is, we have the same drivers doing the same pickups every single day.
Yep.
We have a bench to cover if they're absent. We have walkers that doing the same thing every day. We have an account rep on the job, and we have certain dispatchers have to close out and they have accountability. So we spent a lot of time before we went forward.
Right,
And all
setting
those
this up.
pieces are covered.
Right.
If any of those pieces are out of line, the service failure.
Good
Right.
point.
And I can only speak to this. This was a real conversation Larry and I had, and that was what really Larry said. I might not be the cheapest, but we're pretty damn good. And I was like, okay, that's the kind of mentality I'm looking for. I don't want to have somebody come in and say, "Oh, we can save you so much money." Yeah, well, compromise your quality. I mean, that's not. This is just the stakes are too high in this type of industry.
And that's what we would like to see uniform. Everybody, we're not delivering pizzas again. We're not delivering envelopes.
That's right.
It's a higher end thing, and like you said, when you have to beat up people for price, the drivers are going to be like, I'm making what? I'll make more delivering boxes.
Right.
And they don't have the heart to do it sometimes, and that's a hard thing to do. And more people like you that realize that, it's a good thing. I mean, it'll take 2 years.
I think there's more people in the medical industry than you realize, which is why we're having this conference. Because I wanted you guys to hear from the medical professionals that do this every day, how they really feel. Because we've all been stuck in a transportation mindset of, competition with banking and home mortgage and auto parts and boxes and legal and all of that, and that's all important still, but some of that has gone away, but the medical is completely different. It's a different mindset, and you have to get your head around it before you can address people like Pam and Alex and, hospital CEOs and purchasing people. You have to be able to speak their language, and then their price doesn't become an issue. Yes, it's an issue because they do need to save money. They are up against this Obamacare thing, and that's a big piece of it. But it's not the only piece, and that's where we have to.
Yeah, no, I think when we think of it in these terms, I was talking to Jay last night about the Boston bombings, and Jay said, one way, some way, everyone was affected by that in some way, shape, or form. And it's true. I mean, everywhere I started hearing stories about whatever, and I think it's the same in this kind of industry, at least for us at Strata, where it's like cancer, that's what we're testing for. It's like when you tell a driver, like, do you know a loved one like that has been affected by cancer? Like, that's what you're delivering. That's what we're doing here. That's important to understand that. And I think I think it's great. I think it's great that Ken and Linda put this on. I think it's great that we as a medical community stick together, medical courier community stick together to try to provide the best service we can. And I know with this whole healthcare reform, we're going to see challenges, but I think that it's really about the quality of service we provide, and again, patient care.
Hey, Alex and Pam earlier had talked about lost specimens and so forth, and so some of these other owners and operation managers might have this implemented, but we like to, at the end of the day, when our drivers, because they don't always come back to the office, we make them take a picture of inside their medical bag. And believe it or not, that has helped us. We've caught a specimen twice. And so, it's just kind of a cool deal.
Yeah.
And if y'all never done it, it actually works.
I want to, Pete,
Yeah.
Can you share what you do at your end of your day?
Yeah, we had a situation where a specimen bag was lost, and of course they came to the courier and said, you guys lost it. So we met with the hospital, and it ultimately ended up being in the back of the refrigerator, back in the lab. But what we did is we implemented a call center where at the end of every day, every courier calls an 800 number, and they say, did you wipe down your vehicle? Did you check your all bags? Did you check under your seat? And that's worked excellent for us.
Oh, great.
Yeah.
That's a great
That's
QC system. That's really
also
good.
taking a picture and sending it back to the dispatcher of the bag is a great
Yep,
idea,
and if you have multiple drivers, they're doing routes and they all kind of come in at the same time together, then having the buddy system is great as well. Having drivers kind of nudge each other and say, hey, did you check your car? Check your bags, kind of double check with everyone. Accountability is huge. And that little step will reduce the likelihood of something staying in your vehicle over the weekend and disappear and not be able to figure out where it is. So very helpful. That's it.
All right, thanks a lot, guys.